There's many decisions and deadlines during Medicare enrollment, and missing an important enrollment window may affect your costs and coverage for years. Today I'll be walking through what Medicare is, Parts A through D, and where the costly mistakes happen. I'll walk through what tends to matter most, step by step, so you can approach this decision with more confidence. I'm Mike Worthington, a partner and financial advisor at Stonebridge Financial Group. We help hospital and health system employees make informed decisions around financial planning. Let's start with the basics. Medicare is federal health insurance generally available starting at age 65. After decades of paying into the system through payroll taxes, Medicare is designed to help offset the cost of your medical care in retirement. It doesn't cover everything, but it can help with hospital stays, doctor visits, tests, and a range of preventive services. Medicare is generally broken into 4 parts, and understanding the differences can make the rest of this easier to follow. Part A is hospital insurance. It generally covers inpatient hospital stays, and for most people, there's no monthly premium, since you already paid into it through payroll taxes during your working years. In 2026, if you're admitted to the hospital, the Part A deductible is $1,736 per benefit period. Part B covers outpatient care, things like doctor visits, lab work, and physical therapy. Part B does come with a monthly premium, which is $202.90 in 2026 for most people, along with an annual deductible of $283. After that deductible, Medicare typically covers 80% of approved costs, and you're generally responsible for the remaining 20%. Part D covers prescription drugs, and costs vary depending on the plan and your specific medications. And then there's Part C, often called Medicare Advantage. These are plans offered by private insurance companies that bundle Parts A, B, and often D together, sometimes with added benefits like dental or vision coverage. Now, here's the part I really want you to pay attention to, because this is where a lot of costly mistakes happen: timing. When you turn 65, you generally get a 7-month window to enroll, called your initial enrollment period. That's 3 months before your birthday month itself, and 3 months after. Miss that window, and in many cases, you could face penalties that last for the rest of your life. We'll walk through exactly how that math works in a moment. Something else worth knowing: if you're already receiving Social Security benefits before turning 65, you may be enrolled in Medicare automatically, and a card will generally arrive in the mail. If you're not yet drawing Social Security, enrollment is generally something you have to initiate yourself through ssa.gov, by phone, or in person at a local Social Security office. Let me walk through a hypothetical example to make this more concrete. We'll call him Robert. Robert is 64, earns around $180,000 a year, and has built up $800,000 across his retirement accounts. He's also on track for a modest pension and Social Security once he retires. Robert is still working when he turns 65, and his employer has more than 20 employees. Because of that, Robert may have more flexibility on when to enroll in Medicare, as long as his current group health coverage is considered creditable, meaning it covers prescription drugs at a level comparable to Medicare. For someone in Robert's position, one commonly recommended step is to check with the employer's HR department to confirm whether the current drug coverage counts as creditable, since that detail can affect penalty exposure later on. If Robert works for a smaller employer instead, generally fewer than 20 employees, Medicare would typically become his primary coverage at 65, which changes the calculus around when enrolling makes sense. This brings us to the late enrollment penalties, and I want to walk through the math, because the numbers tend to add up more than people expect. For Part B, if someone delays enrollment without qualifying coverage, the penalty is generally an additional 10% added to the premium for every full 12-month period they went without it. And that penalty typically applies for as long as the person has Part B. Here's an illustration. Say someone waited 2 full years past their enrollment window. That's a 20% penalty. On the 2026 premium of $202.90, that works out to roughly $41 extra a month for the rest of that person's life. Over 20 years, that can add up to somewhere in the range of $10,000 in penalties alone. And this is simplified math for illustration purposes, since actual premiums change from year to year. Part D works a bit differently. The penalty is generally 1% of the national base premium, $38.99 in 2026, multiplied by the number of months someone went without creditable drug coverage. That amount is also generally permanent, and it can apply even if someone later switches plans. So now that we've covered the timeline and the stakes, let's talk through the choice most people eventually face: Original Medicare versus Medicare Advantage. With Original Medicare, you generally have Part A, Part B, and a separate Part D plan. One advantage is flexibility. You can typically see any provider nationwide who accepts Medicare. One trade-off is that there's no cap on out-of-pocket costs, which is why many people also add a supplemental policy, sometimes called Medigap, to help manage that exposure. Medicare Advantage plans, on the other hand, often bundle everything together, sometimes with a lower monthly cost and added benefits like dental or vision. In 2026, these plans generally cannot require more than $9,250 in out-of-pocket costs for in-network care in a given year. The trade-off is that coverage is typically limited to a specific network of doctors and hospitals, and referrals may be required for specialists. Neither approach fits everyone the same way. A few questions that can help guide the conversation. Do you travel frequently or split time between states? Do you have specific doctors you'd like to keep seeing? How many prescriptions are you managing? And would you want dental or vision included? Those answers tend to point different people in different directions. If enrollment is something you need to handle yourself, the process is generally straightforward. You can apply online through ssa.gov, by phone at the number on the Social Security website, or in person at a local office. If you're comparing Part D plans, the Plan Finder tool at Medicare.gov lets you enter your specific medications so you can compare total annual cost, not just the monthly premium. And if cost is a concern, it's worth knowing that programs like Medicare Savings Programs and Extra Help exist for people who qualify, and eligibility is often broader than people assume. A call to 1-800-Medicare or a conversation with your state health insurance assistance program, generally called SHIP, can help clarify whether you'd qualify, and that guidance is free. A few of the more common mistakes worth watching for: missing the initial enrollment window, assuming automatic enrollment applies when it doesn't, choosing a Part D plan without comparing actual drug costs across options, and this one catches people off guard: continuing to contribute to a health savings account after enrolling in any part of Medicare, which can create a tax complication. Here's the honest takeaway. Medicare involves a lot of moving pieces, and getting the timing right can matter as much as almost any other decision in this process. A commonly recommended first step is to mark your enrollment window on the calendar as soon as you know it, and then work through your specific numbers rather than relying on general assumptions or what worked for a friend or coworker. If you work at a hospital or health system, this decision often intersects with other retirement benefits, things like a pension or a 403b, which can add another layer worth thinking through carefully alongside your Medicare timing. If you'd like to talk through how Medicare timing fits into your broader retirement picture, I'd welcome the conversation. Thank you for watching, and I'll see you in the next one.